Hi, my name is Dr. Arun Krishraj. I'm an Associate Professor of Radiology and Medical Imaging at the University of Virginia, where I'm also Vice Chair of Quality and Director of the Division of Body Imaging. PixelShine's patent, pending adaptive processing technology, harmonizes look and feel of images of different slice thicknesses, different patient sizes, different slices of a study, and different scanners. We found the quality of the lower dose CT scans processed by PixelShine to be equal to those of the standard dose scans. In summary, PixelShine can provide the following benefits. 1. It can empower imaging centers who have older scanners the ability to provide high-quality scans while using patient-safe radiation dose levels without having to spend $500,000 or $1 million in capital.
Hello, I'm Dr. Andrew Smith, a radiologist and Chief of Body CT at the University of Alabama at Birmingham, and I'll be talking to you about how you can increase productivity and clinical decision support through deep learning CT image processing. Deep learning CT image reconstruction has a number of current uses, including improving image quality, extending the life of a CT scanner, which saves money, decreasing radiation dose, and facilitating high-resolution imaging. Given the improvement in image quality, it is reasonable to predict that DLR will soon be shown to improve diagnostic accuracy and improve productivity by reducing radiologist evaluation time. Let's look at the benefits of DLR another way. DLR reduces image noise. This leads to improvement in CT image quality. This allows for improved accuracy or reduced radiation dose. DLR can extend the usable life of a CT scanner. The improved image quality can improve the efficiency of a radiologist by reducing read times. Both of these save costs, which essentially pays for the DLR software. If you are now interested in DLR for CT image reconstruction, and you should be, you might be wondering how you can get it. There are two main options. GE and Canon Medical offer this technology on their most recent scanners. You may be able to upgrade your scanners if you had a recent purchase, or if you are planning your next purchase. This is likely an expensive approach. To my knowledge, this technology is not available by Siemens or Philips. Further, this would only get you DLR on one or some of your scanners. The other approach is to choose a vendor-neutral solution. This would allow you to have DLR on any or all of the scanners that you choose to activate the service on. This is also a cost-effective approach.